Hello, my name is Penny Edwards and I'm a health protection nurse with Public Health England South West Centre. This presentation has been produced by members of the South West Public Health England team and colleagues in NHS England. This is the second of a series of videos covering a range of topics relating to the prevention and control of the new coronavirus known as COVID-19. This one covers staff protection and well-being and is an updated version of the one previously sent. The information in this presentation is correct as of the 20th of April, and it is vital that you keep up to date with the most recent guidance online because we're learning new things all the time. Most of the documents referred to can be found on the gov.uk website. We are really keen for you to listen to these presentations and to let us know what questions you still have. We would also like to hear your experiences and suggestions, and for these to be shared across the sector in the South West. So please email these to swhpt@phe.gov.uk and also email us for details on how to dial into our daily week meetings where we can discuss these issues. These are the key websites and we recommend that you pause now and search for them and bookmark them if you haven't done so already. The health and well-being of staff in the care sector is of vital importance, and this is the focus of this presentation, which includes protecting staff health, the importance of hand hygiene, the safe use of PPE, and how to obtain PPE. Staff who are in risk groups or who are pregnant may need to be deployed elsewhere during this pandemic. If you are worried, speak to your manager and take a look at the occupational health and information for businesses on the COVID-19 gov.uk website. Staff who have been asked to shield must not come to work. I would like to stress the importance of staff taking regular breaks and keeping well hydrated while at work. This is particularly important during an outbreak because, for example, when you're tired, you may not put on and remove your PPE properly, and this may increase your risk of infection. Standard infection control precautions are the measures that you need to take to prevent the spread of infections from person to person by protecting staff from blood and body fluids, but also to stop the transmission of microorganisms even when an infection is not present. So, for example, we've got germs living naturally on our skin, and there are those found on surfaces and in the environment. Standard infection control precautions must be followed by all staff in all care settings at all times and for all persons, whether infection is known to be present or not. You'll already be familiar with these measures, and they're listed here on the left-hand side, but now is a good time to ensure that all of your existing policies and procedures and staff training is up to date. Transmission-based precautions are the additional measures on top of standard infection control precautions needed for the care of people with known or suspected infections. And they depend on what we know about the way each infection is spread. So for COVID-19, we're talking about contact precautions, such as those involved in isolation care and hand hygiene, and also droplet precautions, for example, the use of masks and eye protection. This presentation will now focus on hand hygiene and the use of PPE, and these other issues are covered in the other videos. We've all been asked to wash our hands more frequently, and it's one of the most important things we can do to protect ourselves and others. And here are some examples of when we should be cleaning our hands during our day-to-day life. But in addition, care staff need to clean their hands more frequently than the general population to prevent the spread of microorganisms, including COVID-19. It's important for staff to clean their hands before and after touching a resident for all direct care activities, including after exposure to blood and body fluids, and after contact with the resident's immediate environment, for example, after room cleaning. As well as knowing when to clean your hands, using the right technique is also really important. You'll have seen posters like this before, and they show the step-by-step technique that should be used to effectively clean your hands. So it's important that staff are reminded of this. Wash your hands with liquid soap and water and thoroughly dry, or if using an alcohol hand rub, ensure that it is rubbed across all areas, and a gel that contains at least 60% alcohol is used. You must wash your hands with soap and water when they are visibly soiled or when caring for a person with a diarrheal illness such as C. diff or norovirus, as alcohol hand rub is not effective in these situations. Please ensure hand hygiene facilities and products, including paper towels, are easily accessible and well stocked to support staff to clean their hands. And when providing care, staff must also be bare below the elbow. Please also search for the National Hand Hygiene and PPE Policy online for more information. It's important too that residents are offered the opportunity and are encouraged to clean their hands regularly, and especially before meals, after using the toilet, after coughing or sneezing. Residents should be provided with disposable single-use tissues and a container or bin in which they can dispose of them. Posters such as these are found on the campaign resources on the gov.uk website. This is a general slide about personal protective equipment, or PPE. All stocks of PPE must be stored in a clean, dry area, and staff need to be trained. All PPE must be compliant with the relevant standards, and you can look for this CE mark on the packaging. PPE should be located close to the point of use, but outside the room of someone who is being isolated due to an infection. PPE in health and social care is usually single patient use, but some items may be reused in this period of sustained transmission of COVID-19, and I'll be talking about that a bit later. But it's important to remember that gloves and aprons must always be single patient use and changed between each patient. Also essential is to know that the use of PPE is not a substitute for hand hygiene. It's always necessary that hands are cleaned immediately after removal of PPE. In England, currently, we are in a period of sustained transmission of COVID-19. Before this time, the people who had COVID-19, so the cases, had a direct link with another known case or had travelled to a country or area known to have an outbreak. But increasingly since then, people are being diagnosed with COVID-19 where no such contact is known. Additionally, around 1/3 of people with COVID-19 have no symptoms, and some have symptoms that are very mild, and that can be difficult to recognise in some people, including some of the people that you're looking after. The guidance on PPE reflects this situation of sustained transmission, and it is likely to change again as the COVID-19 outbreak evolves. It is extremely important that all care and cleaning staff are trained in when to wear PPE and how to safely put it on and remove it. If not performed correctly, then staff may be at increased risk of infection. I would urge you to watch this video and ensure that all staff do the same, and then practice putting on and removing PPE. A link to this video is on the gov.uk website and has been emailed to you. And posters about donning and doffing PPE are also on the gov.uk website. I just want to quickly talk about the PPE used for aerosol generating procedures, and they're shown on this green section on the right-hand side of the poster. Now, these are procedures that result in smaller aerosolized virus particles being expelled into the air. And mostly these are performed in hospitals, but occasionally some may be done in nursing home settings. Examples might be open suctioning of a tracheostomy or non-invasive ventilation. Of note, coughing is not an AGP. A full list of AGPs can be found by searching the gov.uk COVID-19 infection prevention and control pages. And this presentation doesn't go into further detail about this because special training is needed. But if you think you're performing AGPs and you haven't had this training, please talk to your employer. So the next slides will go through the different types of PPE used for sort of standard and transmission-based precautions within the social care setting. This first slide is about gloves and aprons. And again, a reminder that disposable non-sterile medical gloves and disposable plastic aprons are always single patient use. Gloves and aprons protect the wearer from splashes of blood and body fluids during care. Also, when a person has COVID-19 or indeed another infection like norovirus, the person and the surfaces and objects in their close environment can also be contaminated. So wearing gloves and aprons helps to reduce the risk of spread both to the wearer and to other residents. But this is only true if they are removed carefully and hands and forearms cleaned. Be careful also not to touch your face, mouth or eyes when wearing gloves. Gloves and aprons should be worn for the following reasons. For personal care of all residents, which requires touching. When within 2 meters of a person who is coughing. Any time that there is a risk of splash of blood or body fluids. Contact with a person or their close environment who are infectious due to another reason, for example, norovirus or flu, and for environmental cleaning and disinfection. This is just a quick slide about how to safely remove disposable gloves. I think it's something that people often do incorrectly, particularly when they're rushed and busy. So now's a good time just to check your general practice and make sure that you are removing gloves carefully. And again, just a reminder, hands do need to be washed as soon as gloves are removed, even if you've been really careful taking them off. This slide is about eye protection. Eye protection can be achieved by using an individual surgical mask with an integrated visor. You can get full face shields or visors, or safety specs, which are usually made of a polycarbonate material. And just a note to say that usual kind of prescription glasses are not considered adequate eye protection. Eye protection is designed to provide a physical barrier that protects the wearer if there is a risk of splash of blood, body fluids, or respiratory droplets to the eyes. They're also used for aerosol generating procedures. Some eye protection, so for example some goggles, are designed to be decontaminated and reused, but you need to check the manufacturer's instructions. Eye protection should be used whenever there is a risk of eye contamination. For example, from someone who's repeatedly coughing but who lacks the ability to sort of turn their head away from you or to cover their cough, or when dealing with blood or body fluid spills. And these are the 3 different types of masks that you would have heard about. The first is a fluid repellent surgical mask, and this will be marked as a type 2R. The surgical mask will be marked type 2 and without the R, and that's because it doesn't have that fluid repellent layer. FFP3 masks are special respirator masks which are used for aerosol generating procedures only. Fluid-resistant surgical masks protects the wearer from splashes of blood or body fluids from entering the nose or mouth. Fluid-resistant surgical masks also protect the wearer from droplets produced when the person you are caring for is coughing and you are within 2 meters of them. Surgical masks protect both the wearer and the resident from respiratory secretions that are produced normally, so for example while we're talking, but not the droplets that are produced when near to somebody who is coughing or if there is a risk of splash from blood or body fluids. Surgical masks reduce the risk of spread of COVID-19 when a person, so that could be a resident or a staff member, is infected with COVID-19 but doesn't realise it because they don't have any symptoms, but they are within 2 meters of another person. This slide summarises some of the scenarios and what sort of mask you need to wear depending on the activity that you're doing. I would suggest that perhaps you pause the video now and just check your understanding. You could always refer back to the previous slide for the rationale, or have a read of the How to Work Safely in Care Homes guidance document on the gov.uk website. I mentioned earlier about using PPE for more than one resident, and this is known as sessional use of PPE. A single session refers to a period of time when a health and social care worker is undertaking duties in a specific clinical area or environment. So in a care home setting, masks and eye protection can be worn and kept on by staff working between residents perhaps in a particular area of the home until they need to leave for a break. This is because eye protection and masks are not in direct contact with residents, and as long as staff do not touch their mask or eye protection, then the germs will not be spread between people in this way. However, gloves and aprons must always be changed because they do make contact with residents and the environment. All PPE must be removed and disposed of after the care session has finished or once you have left the area for a break. You must remove PPE if it's soiled or damaged, or the mask is damp, or if any of it is uncomfortable. In these situations, all PPE must be removed, disposed of, and hands and forearms cleaned. Again, it's essential that staff have regular breaks and, if possible, have someone to observe them removing their PPE, because tired and dehydrated staff will forget to not touch their face and may remove the PPE in the wrong way. When you have a number of people with suspected or confirmed COVID-19, it would be useful if you can separate staff into groups, and that's known as cohorting. So you might have one group of staff looking after people with symptoms and another to look after people without symptoms. I'd advise that staff who are caring for people who are shielding should use single-use items, because these residents are extremely vulnerable, and these staff should avoid caring for patients with symptoms of COVID-19. In the absence of disposable face and eye protection, reusable goggles are an alternative, but they must be properly decontaminated. This document provides information on how to decontaminate reusable equipment, including goggles, although it is still important to check the manufacturer's instructions. But it's a useful document when you're considering how to decontaminate any shared equipment, and you can find it on the gov.uk website. Essentially, it advises for things like reusable goggles used for the care of a person with COVID-19. You will need to clean these with a general detergent using disposable cloths and wearing gloves and aprons, and then disinfect with a disinfectant solution containing 1,000 parts per million of available chlorine. And again, you need to look at the manufacturer's instructions to see how you can achieve this. Any decontaminated reusable equipment must be dried thoroughly before reuse. And a quick note about staff uniforms. This is standard advice, but is particularly important at the moment because of public anxieties. We think the risk of spread from uniforms is very low if PPE is worn, but these are still sensible precautions to take. So the best practice is to change into and out of uniforms or dedicated work clothing at work and not wear them when travelling. This obviously may not be able to be applied to community health workers, but I would still advise that you try and keep your uniforms covered while travelling. Uniforms could be brought home in a disposable plastic bag and then laundered separately in a small load and at the hottest temperature that the fabric can tolerate, and then dry it thoroughly and iron. We know that the process of getting PPE stock is of concern in your sector, and hopefully you have already seen this process about how to gain PPE stock. Ultimately, if you cannot get stock through your usual supplier, through the suppliers mentioned here, or from the National Supply Disruption Service in time, then escalate to your adult social care contact in the local authority. Again, here are some useful links that have been previously circulated. And finally, thank you again to colleagues from the South West and London Health Protection teams and in NHS England Improvement. And just another reminder to please email your feedback, questions and suggestions, and to please join us in our daily question and answer sessions. Thank you very much.